Hey everyone, my name is Lavonne and welcome back to my YouTube channel. I am thrilled to be able to offer you this incredible resource who is Dr. Amna Husain. She is a pediatrician and IBCLC, so she's a lactation expert. And we are gonna just have a conversation and sort of let you into that conversation specific to COVID and vaccines related to your pregnancy, labor, birth, into the postpartum period and breastfeeding. So this is sort of like an umbrella for all of that. And I will just say that up until this point, I have somewhat avoided this topic on my channel. And that's because the information is changing constantly. And so I do have to say right now that what we're talking about today is current as of January 4th, 2022. And as the guidelines change, we will link some resources down below for you to check out. But up until this point, we do actually have some really helpful information. And I'm so excited to let her introduce herself, give her a little bit of her background, and then also let you into some really helpful evidence-based information related to COVID-19 and vaccines. So we're so excited to have you here on this channel.
Thank you. I'm excited to chat with you. Sarah, thanks for that introduction. But yes, my name is Dr. Amna Husain. I'm a board certified pediatrician. I'm a lactation consultant, but I'm also a mom to two. And managing this pandemic has been pretty difficult. I actually had my second daughter while being pregnant. And, spoiler alert, I actually got COVID in pregnancy. So a lot of these topics that we're going to be hitting on are very, very near and dear to my heart because I counsel, prospective parents on these topics. I counsel nursing mothers, breastfeeding parents on this topic very frequently. And as you mentioned, the data is changing constantly. I think one thing is for sure is that Omicron is very uncertain. COVID is very uncertain. It's always mutating. The data is always evolving. So what we can get out there and be able to educate families, educate parents, I'm happy to help.
Yeah, I love that. Well, I am grateful to have your help in having this conversation on this channel. So let's jump into it. As far as related to pregnancy, let's kind of start with pregnancy and work our way forward. What do we know about the current state of COVID-19 related to risk in pregnancy? And then leading into what are the recommendations for pregnancy related to really avoiding COVID is the goal, right?
Yeah. So let's talk about that. So first of all, I want to give a disclaimer, just like we mentioned, that I'm not an OBGYN, I'm a pediatrician, but actually OBGYNs and pediatricians, we work very, very closely hand in hand, as you know, Sarah. So we're right there in the delivery room waiting to accept the baby. And we know that mom's life is very intricately intertwined with babies, right? There is no healthy baby if there is no healthy mom. Yeah. So how do we keep mom healthy? How do we take steps and measures during this very difficult time to continue to keep you healthy? Mm-hmm. Well, generally, pregnancy isn't necessarily a time of being immunocompromised, but lowered immunity, which is actually kind of amazing when you think about the physiology of the body. It allows pregnancy to progress. Yes, your immunity is a little lower. That's why we see, interestingly enough, eczema flare sometimes in pregnancy. And sometimes you can see the immune system do some funny things. Some autoimmune diseases might even improve in pregnancy. It's very interesting.
Yeah.
So what can we do to really keep a mom healthy? Well, when this pandemic first started, it was very terrifying, right? We think back to Zika, and we were thinking worst case scenarios possibly for babies. But what we understand from coronaviruses generally, which is a family of viruses, going back to virology 101, COVID-19 is from the coronavirus family. And these viruses, they circulate in environment, and it can cause what we call upper respiratory tract infections, cough, runny nose, sniffles, fevers, etc. Well, let's break it down sort of by trimester is what I try to tell families. The risk in the first trimester is really a fever. You want to really try to prevent high fevers if you can. And that's just any viral illness across the board, because that can be sometimes detrimental. Now, that being said, everything isn't always controlled by us, right? So you just try to do your best. What I always try to tell mothers in general, and being a mother myself who contracted it in my first trimester, was I always talk to my doctor. So I talked to my doctor. That was the first thing. I actually had an appointment I think the next day, and I obviously had to cancel that appointment because I was COVID positive, but I had a real heart to heart and told him that, look, I'm a doctor too. I'm a pediatrician. Tell me the worst case scenario, what do I need to be aware of? And honestly, we kind of didn't know what was going to happen with the first trimester. So big guidance to him from me was, keep taking your prenatal vitamins. That's really important, actually. It's not just some, cuckoo talk that we say. It is really, really important, actually. You want to keep your zinc levels high. You want to keep your iron levels high when fighting an infection. You want to try to keep yourself really, your immune system as strong and humming as you can while trying to fight an infection. Vitamin D, vitamin C. Thereafter, he also mentioned purchasing a pulse oximeter, which I think is actually a really good idea right now. If you're a mom or an expecting mom, to go out and buy a pulse oximeter, you can contact your doctor for guidance on which ones.
Really good idea.
Right? Because so that was something that I could like slip on my finger, and I actually checked my vital signs every 4 hours. And as I got better, it was every, 6 hours, then every 12 hours. But I was able to kind of keep an eye, and he had given me parameters to be aware of. Now, my parameters, Sarah, you understand this might not be the same as other parameters for other women who have high risk conditions. That's why it's so important to talk to your doctor about this.
Yep.
And he also mentioned trying to keep my fevers low. For important reasons, right? You want to make sure that you kind of keep your body temperature at a normal amount where you should be, because too high of temps can run into potentially issues down the line with the pregnancy. Now, that's the guidance my doctor gave me, along with red flags to be aware of. And I think that was really helpful. Now, as you know, in the first trimester, there's not really a risk of preterm labor as much as there's a risk of potential miscarriage or pregnancy loss. And as your pregnancy progresses, second trimester, and especially third trimester, that's really, I think, the scary time when you could possibly run the risk of, if you are getting very sick, it can trigger preterm labor.
Yep.
And I wonder, Sarah, has seen that at all from the inpatient side with women who have potentially come in COVID positive and are pregnant?
I have, actually. So, and that's the data that we do have, like now that, and the good part is we're having this conversation years into the pandemic, not like the first month. And so now we do know that there is a risk for preterm labor and potentially a risk for stillbirth as well. But absolutely, we are seeing more risk of preterm labor in the hospital. I know that from the bundle birth nurses side for sure.
Yeah, I mean, there's a higher risk of intubation, higher risk of what we call ECMO, or it's an acronym for extracorporeal membrane oxygenation. But essentially, your lungs are not doing what they're supposed to be doing. And think about it. You have this, big uterus that's already pushing up on your lungs and your heart, kind of making it harder for your lungs to do their job when you're in your third trimester, and then sort of compound on top of that a potential respiratory disease.
Right.
Which brings me to, what can we do to help prevent that? Mask wearing, hand washing, which I think pregnant women in general are very good about washing their hands. You always want to make sure that you're, being as safe as you can, but mask wearing is also an important part of the equation that we probably weren't used to before this pandemic came around. And the last part of it is really trying to vaccinate yourself and be around those who are vaccinated. You want to really try to, we call it in medicine, but a Swiss cheese model, and you stack up enough layers of that Swiss cheese that you kind of make as safe of a kind of barrier, wall, or window between you and the potential exposure. And that's about the safest thing you can do. Now, I know some women have a lot of questions about this in pregnancy, and I'm sure you've heard that too, Sarah, from pregnant women who are, wary about getting the vaccine in pregnancy.
Absolutely. Absolutely. Well, and there's a lot of questions, especially early on, there were a lot of conversations about fertility and its effect on your fertility. Should I wait to get pregnant? And then is there a difference in when to vaccinate? Should I wait till the third trimester versus the first trimester? Et cetera. So yeah, I mean, those are probably my most common questions that I see.
Yeah. And I will say that in this age of social media and the internet and digital age, it's, scary things, misinformation can be put out there. And unfortunately, the scariest, most blatant sort of headlines are the ones that stick. When
Yeah.
somebody tells me that, your fertility is going to be impacted, of course, that's going to stick with you. Even if you don't have kids on the brain, it's going to stick with you for years and years to come. That's just something that you've always maybe imagined for yourself.
It was a barrier for me. I was in the process of egg freezing through the pandemic. I froze my eggs twice. And I waited on getting the vaccine the first time because it was like right when it came out, it was available to healthcare workers, but I was like, I'm scared. I don't want it to mess anything up, and then it was booster time, right when I went to do my eggs again. So I even relate to that piece of like, what do I do? And at that point we didn't have a lot of info, but now we have a little more.
Right. And I understand it, because if you think about the first vaccines that came out, they were mRNA vaccines, and people were like, well, I've never heard of this before. And it's true. You probably haven't, because when would your job ever relate to mRNA? It didn't, right? These are things that scientists have been working on for decades before this pandemic came around. And a lot of people are worried about things being rushed. And I have to, paint this picture for everybody that when vaccines are being developed, perhaps you've heard of the RSV vaccine or GBS vaccine. Those are all being developed actually right now, but nobody hears about them because, one, who's going to fund some of these vaccine trials, right? You have to find funding at the end of the day. These labs have to find funding. You have to find volunteers. And perhaps maybe for some people, volunteering for an RSV vaccine isn't a big deal to them. Right. So all of these things, they all kind of line up, and you need to have enough time to really line up those participants and do these trials. Now, flash forward to the pandemic. Funding, you had billions of dollars.
All of it.
All of it.
Yeah.
Participants, people were lined around the corner to try to help out. Like even the pediatric trials, I'm constantly getting messages about how can I enroll my child in. Nobody ever messaged me about the rotavirus vaccine. Right. So this is something that made headlines, and people it was a beautiful thing actually. We're coming around all around the world, rather than let's try to make this vaccine before this company. No, they were actually talking to each other. International companies trying to work together to create this vaccine. Does it feel fast? Yes, but that's because all the little pieces behind the puzzle, the funding, the participants, getting all our ducks in a line, that's what was sped up, not the science actually itself.
Totally. Yeah.
And I think that that's something very difficult for perhaps many people who don't work in science to understand, because vaccine development isn't often the first thing that we think of. It's always kind of something in the background.
But it's happening constantly.
It is
the background, whether we know it or not.
Exactly. I just posted about this on my social media on TikTok the other day, is that there is an RSV vaccine in development. There is a GBS vaccine in development. There are many vaccines in development for viruses that we commonly see. The flu vaccine is tweaked every year. It's just that this is something that once somebody throws in that your fertility might be impacted, it can be very scary. But I want to assure everybody, today, as of January 4th, and as we've continued to disprove, is that this vaccine does not affect your fertility. It doesn't. And unfortunately, that's just terrible misinformation that just needs to die and be put to rest. But I get it. Just like you, Sarah, I was in my first trimester, and I actually contracted COVID in November of 2020. And if you kind of remember, the vaccine came out in December of 2020.
Yep.
So around that time, there was a little bit of, well, if you've had the infection, you can wait 90 days, but unless you're an essential healthcare worker, which I was, you can get it earlier. And I was a primary care physician, testing and swabbing people throughout the pandemic, taking care of patients. So I qualified. And I almost, because I'm a pediatrician, I kind of follow along with the same ACOG guidelines, and I almost knew everything around, myself. But I actually had this moment where I looked at my husband and I was like, well, I talked to my OB and she said, go for it. I mean, are you okay with this? And we almost didn't even talk about it because we were so much on the same page.
Yeah.
And he was like, no, I trust you. But it kind of, I almost had a hiccup too, where I was like, am I doing this? Because I'm so
practice what you preach.
Right. I'm so confident in the science. I would get this vaccine in my eye if I could, because that was one of the scariest weeks of my life, was being pregnant and having COVID-19. I was so afraid that perhaps we would miscarry because I wasn't protected from the vaccine at that point.
Yep.
And so I got my first dose in the first trimester and my second dose in the second trimester. And, the data has shown that women continue to go on to conceive, but also from the newborn standpoint, they are actually born with antibodies, which is amazing.
Which means the vaccine can be protective for your infant, given that infants aren't getting vaccinated for COVID-19,
exactly.
Which is amazing.
And I have to also tell people that a lot of people ask, well, then what's the best time to do it? It must be in the third trimester because that's when you're about to have the baby. But actually, what we understand is it doesn't really matter. Just do it. Just do it when you can. Get vaccinated and get boosted. And I want to make that point because, when I got my vaccine, boosters weren't even on anybody's radar. But science evolves. Data evolves, and it's showing that we should actually be getting pregnant women along with everybody else boosted as well during this time. That doesn't mean that you stop washing your hands or you stop wearing your mask. This is just exactly Swiss cheese.
Yeah.
So that if you do contract COVID-19, which you absolutely still can, there are breakthrough infections, that your course will be less severe. And hopefully you won't land in the hospital for low oxygen levels to your placenta or, respiratory distress, or have to be intubated, or God forbid, have premature labor or have a preterm baby, a stillbirth, anything like that. Those horrible outcomes that we want to avoid.
Well, and I think it's important to recognize that when we're weighing the risk of vaccine, or the perceived risk of the vaccine, we also have to acknowledge that the risk in pregnancy of contracting COVID-19, it can be more serious for you. We do see, increased hospitalizations. There is risk to your pregnancy. And so sort of that's how I envision it in my head when you're weighing that risk of potential for potentially vaccine stuff we don't even know about, knowing that it's been safe for many, many people, compared to getting sick. Getting sick can be really serious. And so let's add that layer of protection throughout your pregnancy. And then bonus, you get some protection for your newborn as well.
Exactly. I mean, I think I always kind of akin it back to the flu vaccine, which we've continued to consistently recommend for pregnant women. Is influenza. Yeah, sure. The flu sounds bad, but no, the flu can cause some really serious complications in pregnant women, really serious complications, preterm delivery, and that can cause complications for your baby. So what you can do to help your baby when you're pregnant is continue to be the healthiest you, continue to do the best things you can, and help keep yourself safe. And one of those measures is vaccinating. And I think that it's really important. I've heard a lot of OBGYNs, some of my good friends on social media say this, but if anybody is kind of recommending against it at this point, they're recommending against the standard of care.
Yeah.
And if you really aren't getting good data or a really good conversation with your OB, then get a second opinion, get a third opinion if you want. And I think that's very validated. A lot of women and parents and prospective parents, just generally, I'm very proud of them that they're seeking reliable health sources online, such as yourself, to get this information.
Right.
But perhaps it doesn't translate to their doctor in real time when they go to make their appointment and they want to have a conversation. So then get a second opinion. You have every right to take your health into your own hands and find the data that you need.
Absolutely. So then what about boosters? Because now it's like the whole hot topic is boosters. Should I get boosted?
Yeah.
I've been vaccinated. I'm due for a booster. Should I do it? Should I wait by trimester? What's the story? Talk to me about boosters.
So this is the thing. Anybody who has been vaccinated, whether it's Johnson & Johnson, Moderna, Pfizer, etc., you should be getting a booster. Now, if my population, my pediatric population, there's like caveats there about which one you would qualify for. But if you are at least 18 years of age or older, you can absolutely get any of the 3 boosters. Usually we recommend getting it at least 6 months after the primary first 2 series, except the Johnson & Johnson, which should at least be 2 months after you get that first vaccine for the Johnson & Johnson. Now, when I just saw
the Pfizer come out that they pushed it to 5. If you have Pfizer, it's 5, so, Moderna is 6, Johnson & Johnson is 2.
Right. And to explain that for everybody too, the FDA recommends that. And then the Advisory Council on Immunization Practices, or the ACIP, approves it. And then the CDC creates that guideline. So just like Sarah said, the FDA has said it, but there's a few steps ahead of the way that still need to be done. So this proves to you actually that there's a lot of check boxes that need to be checked along the way. It's not just that Pfizer woke up one day and said, I think, they should get it at, 5 months instead. There's actually data that gets vetted by multiple large bodies of medical communities that are unbiased, completely unbiased.
And really trying to protect you and to provide recommendations that are to help keep all of us safe and help us also end up on the other side of this.
Absolutely. And one thing I wanted to mention is with the vaccines, because this has probably been one of the first times ever. I've never grown up where I've, gotten a chance to pick which chickenpox vaccine I get. You kind of just get which one is stocked. Same for the flu vaccine. Nobody's ever asked me, is it Afluria or Fluvax or Flu-Laval? Like, you kind of just get whatever. So perhaps this is your first time ever saying, like, I'm going to walk up to the counter and ask which one they count. So that might be an important moment to talk to your OB, because there are some women, and I'm sure you've heard of this too, Sarah, is that, with the history of clotting, for example, if you have a clotting disorder, perhaps J&J may not be a good vaccine for you. And I've heard many OBGYNs counsel about this. Now, that's something an OBGYN should be able to counsel you on. I'm not, Sarah and I are not going to be the ones to provide that kind of data for you, but if that's something that you want to talk to your doctor about, well, I want to get the vaccine. They say, great, go for it. I recommend it too. You can get it in any trimester you want. Protect yourself as soon as possible. A good question would be, which one should I get? If perhaps you're needle phobic and you say, I just want to get one shot, they'll say J&J. Perhaps if you're, worried about mRNA, then you can talk to them about that and see if it's actually a concern that's validated. Perhaps those are really good conversations, I think, are important to have.
Yep. And then as far as related to the booster can be technically even mixing and matching, which I found really interesting originally.
Yeah, I agree. So one thing that we say is that, yes, you are still considered fully vaccinated 2 weeks after your second dose of the 2-dose series, so the mRNA vaccines, or 2 weeks after your J&J shot. You are still considered fully vaccinated, but the booster does increase your antibody levels even further, which is kind of nice to know during this surge where we're seeing such high cases and such easy transmission. Omicron, what we know as of now, January 4th, is that it is almost 4 times as transmissible as the original variant, and Delta was 2 times as transmissible. I do think that we are seeing less severe cases, and likely that's probably due to sometimes the mutations in a virus can actually cause it to become less severe, or what we call less virulent, but it does allow it to become more transmissible. And I think that's important to point out. Another thing is the infections you're seeing and breakthrough cases are from vaccinated people. So we know the vaccine is working. The booster shot is just going to further help you. And any kind of side effects that you might see from the booster shot, usually you'll have, pain at the injection site. You could have a low-grade temp. I do want to point out that a low-grade temp is no reason to avoid getting the vaccine. It's usually high-grade temps in pregnancy that your OBGYN will warn you about. Tired, headaches, muscle aches, all of those things are very normal to see as your immune system is kind of fighting and ramping up antibodies.
So no matter where we're at in our pregnancies, we are getting vaccinated, fully vaccinated. If you're due for a booster, get boosted.
Yes. And I think having these questions are very valid. Nobody should brush you off. Nobody should brush you off. And like I said, if they do, get a second opinion. I often get that sometimes when people want to go to their OBGYN with questions, and perhaps maybe pediatricians are just easy to approach. And I'll often tell people that I'm like, hey, I'm not an OBGYN. You should definitely talk to your doctor. But we often share the same data because, again, baby's life is very intricately linked to mommy's life and well-being. We want a healthy mom so we can have a healthy baby. So we pediatricians, we want you to get vaccinated for COVID. We want you to get vaccinated for flu. We want you to get vaccinated for Tdap to protect against the risk of pertussis. And not only that, Sarah, everybody around baby. So dad, grandparents, anything like that. And this would be a time, if I was a pregnant woman, that I would be picky about who I'm around. So if you're attending a gathering, you should say, hey, is everybody there vaccinated?
Yep.
And
Yep.
I think that that's a very legitimate
Mhm.
question to have at this point.
Well, and it's sort of like, it goes back to that core. This is, to me, like the most important YouTube video I put out was the rights of a patient, and sort of navigating, making your own decisions while also not really being the expert. Unless you're a labor and delivery nurse, OBGYN, midwife, pediatrician in the medical world, these big decisions that potentially have lifelong impact, they matter and they're yours to make. But the goal is to not make decisions out of fear. And that's sort of where I want to just put out a little alert that if you're reading something that like you walk away being like, I'm going to throw up, I'm so scared, I am so not hopeful, oh my gosh, like doomsday, that to me is a trigger. Like, hold on, okay, where is this data going? Because I think there's hope. I think we have some great data. I think we know about hand washing, masking, social distancing, vaccinations, enough that we can mitigate this stuff. And yet you're responsible for your decisions, right? And so it's sort of, it's on you and all of us to take that personal accountability of how are we participating in the bigger picture of protecting each other, and then also smaller picture, protecting your own family. And that may mean missing social gatherings with people that haven't been as responsible as maybe some other people. And that may mean, you know, choosing to vaccinate when everybody in your family is saying no because of whatever data, that we're responsible for our decisions, and really looking to the experts to help guide those decisions, ultimately they being personal to me, and integrating my own values and preferences into that decision making.
Right. And I think it's very easy for us to say, but I really want to acknowledge that there are some tough talks that people have had to have
Oh
with their
yeah.
family members, that, hey, you can't come see the baby until you're vaccinated, or I'm pregnant and I'm not inviting you to this baby shower because you're not vaccinated. And this is like crazy.
I know.
We never would have
devastating.
It really is. It seems very polarizing. And I think it's because none of us really thought this pandemic would go on for, now we're in, you know, the third installment of 2020.
Totally.
Terrible.
Yeah.
But seriously, you know, we think that it's supposed to get better and better. And so all of those things you mentioned, that's what we can do to mitigate the risk. But it's tough. And there's a real level of decision fatigue out there. And I want you guys to know that your doctors, you know, your nurses, we're all here to help you the best that we can. And if at any time you feel like you're not, you know, feeling heard or anything, then that's a moment where you absolutely, just like Sarah said, you got to walk away and figure out what's my best source of information.
Yeah. And your decision may be different. This is the same like advice I give for labor, right? That like my decisions I make throughout my labor course may be different than my mom or my sister or my best friend. And a lot of times that's okay, but we're all responsible for our own decisions and doing our research and like, you know, filling our brains to a place of comfort, and not functioning through the lens of fear when there has been. I mean, even for me, when this thing started, I was obsessed. Like I literally sat with the COVID data tracker thing on YouTube while I slept. Like, I mean, I was like, I need to know all the things. I was obsessed. And now I think you're right with that decision fatigue, and everybody's kind of, our guards are coming down. We're over it. I'm over it. I want to live my life. I want to go out. I want to, you know, live like without a mask, you know, all those things. And yet, you know, I think we're also responsible for the fact that like together, that's how we really end up on the other side of this too. And it is hard. Those decisions are challenging, you know, and I've had to make that recommendation to my clients who have family members that, you know, are sick, where I'm like, you know, I can't tell you that like, yeah, they can come be around the baby masked. Like that's not the safest option, you know, but you make that decision. We're responsible for our decision. So again, it's like that like shared decision-making model that is really challenging to navigate, and also is very emotional at this point in history.
It is. And one thing I often tell families is you can blame me. You can blame that faceless pediatrician and just say, hey, the pediatrician really said that we should only, have vaccinated family members for the first,
I love that.
I don't know, 2-3 months or something like that. And honestly, I would just keep pushing it off if you could, or at least have them wear a mask. It's really tough. Not an easy conversation to have, but definitely worth talking about. And actually, on that note, since we're chatting about babies so much, I think that's another thing, is that there's almost this, like, while baby's inside of you, they're still, and you're vaccinated, you're protecting them, right? But then baby's born and you're like, what do I do? And I think a lot of women have questions about how they can continue to protect their baby after baby's born. And the topic that always comes to mind is breastfeeding. And so I think that that's something we should talk about, not just being an IBCLC, but I am a mom who has, exclusively pumped for my first. I'm a mom who is combo fed both my kids. I'm a mom who's nursing one of my, 6-month-old right now, who I'm hoping still, her probably what we call the immunity, we call them, vertical immunity, that vertical transmission of antibodies that they got when I was pregnant, that's probably fading right now. And I'm continuing to nurse her. So a lot of questions I get are, can I nurse my baby and still protect them from COVID-19? And the answer is, likely you are providing some degree of immunity, but we just don't know how protective that immunity is. And I'll paint you a picture of why that's so. It would be kind of like, I take myself, for example, I am nursing baby and then I have to go expose her to COVID-19 and then see kind of how badly she does. Like, that's not an ethical study at all. No. You wouldn't do that. So what we as physicians know and as scientists know is that, yes, breast milk has antibodies, and we test it, and we have done lots of, studies. There's I have a YouTube video on it, but there's actually taken milk from nursing mothers in Oregon, and they've taken small amounts and seen, what's the antibody concentration, etc. And yes, there is some antibody there, but we just don't know kind of how protective it is. So that's why we recommend that Swiss cheese model. So in addition to, yes, you can nurse your baby, but that's just not only enough. That's why even for childhood vaccines, you can nurse your baby, but eventually that immunity will wane and you will need to vaccinate them so that they can have those strong antibody titers. One important thing to point out here is, when you breastfeed a baby, the type of antibody that we have, IgA, it coats what we call the mucosal tracts, the mucosa of the nose, the mouth, and the gut. But when you vaccinate a child, it actually gets the antibody circulating through the bloodstream. So it's the amazing thing about the body, is that you're kind of have these multiple pronged immune system sort of fronts that the body can fight infection on. And so that's why the two kind of together work well. But until then, yes, we do believe that nursing your baby can be protective.
On top of Swiss cheese, of potential, of socially distancing, vaccinating those around them.
Absolutely.
Hand washing, all the stuff that honestly is a recommendation, whether we were in the middle of a pandemic or not, that we know that newborns are more susceptible to disease in general. So anybody that's coming around them, you're having them wash their hands. If they're sick, they're either avoiding or masking if you can't avoid it. Stuff like that. But it is. I like that you brought that up.
For sure. I mean, you have, if somebody's coughing, and even if they're COVID negative, I don't want them coming near my kid. Don't bring the common cold into my house either. Don't bring the flu into my house either. Don't bring RSV into my house either if I can help it. Now, let's say you have a toddler like me and they're sniffling and then they kiss the baby. Yeah, there's some things you can't control, which I really want to make, as somebody who works with parents a lot, and this pandemic has really strained parents' nerves. There's many things that you can't control. So you do the best you can, but I don't want you guys, I've had, for example, Sarah, lots of questions of people come through that they are so ready to stop nursing now. They are way past the point and they are just continuing to nurse because they hope it'll be protective for their baby. And I want to make that clear to you guys that your child needs you at their best, first of all. So just like that statement I just made, that yes, it's probably protective, but how protective, we don't know. Please don't continue forcing yourself to do something that you're ready to kind of give up,
Mhm.
just for a theoretical possible benefit. And I think that's really, really important to
Super
mention here.
important. Well, and I say there's nothing worth your mental health. I
Yeah.
say that all the time. That's one of my like Sarah-isms or whatever. And I think this is the perfect example of, if you are truly struggling and over it, that like you have to weigh that. Like, at what point is it really affecting your mental health to continue?
Right. I mean, I've had a mom who was actually trying to nurse her baby, but also give her toddler a little bit of her breast milk as well, so she would get that benefit. And she was kind of just like strapped, because she was like, I can't make enough milk. And I was like, wait, just stop for a second. This is like, you're like an amazing mom that you're
Right.
even trying to do this and think this way. But at the end of the day, like, your child needs you more than she needs your milk or anything like that.
Mhm.
And I think that's really important to point out here. So whether you are, pregnant and about to consider nursing, or you're just not sure about it, or you're on day, 408, 82 of your nursing journey, and you are ready to be done.
Yeah.
And the only reason you're continuing is this benefit of breast milk. Just, you do not have to do that. Vaccines will come for your child, but don't feel like you have to nurse and just to give them that benefit. But I think that, that's a good question in terms of, can you get the vaccine in pregnancy? Can you get the vaccine while breastfeeding? Can you get the booster while breastfeeding? Absolutely. It will probably only benefit more. For example, I guess I hit the trifecta. I got the vaccine when I was pregnant, first trimester, second trimester, I got the booster while nursing. So yeah, I probably just kind of gave a little boost. Yeah, I probably gave like a little boost to me, and for the baby. But I think there's absolutely zero harm. A lot of women get concerned that this mRNA is going to, circulate, for example, and go and affect the baby. And I need to like point out to families again that mRNA, it's a blueprint. It's a little piece of protein that tells your body how to make something, and then it gets crumpled up and thrown into the trash. It really doesn't last long in the body. And that's the best way to describe it. It's like literally, when you're at a restaurant and the waitress like writes down your order, and then she like tears off the pad and gives it to the cook.
Yeah.
And he cooks it, and then like your dish comes out. It's literally just like that little piece of paper.
I like that.
It gets like discarded. Nobody even thinks about it. And so a lot of people wondered, is my child ingesting the mRNA? When this vaccine first came out, that was a really common question I had. Well, first of all, it's a protein. So your child's digestive tract would just break it down and poop it out, even if that were to happen. But that doesn't happen. It kind of just stays locally. And then your blood system, your lymphatic system ramps up antibodies. And then that's what really goes into your breast milk and then gets secreted out. It's not necessarily the mRNA itself. And I think that's really important for families to understand.
And misinformation that's been out there. I've heard it compared to that, like by breastfeeding, that's like vaccinating my child. I've heard that a whole lot.
Yeah, this is something I actually chatted with a pediatrician, Dr. Paul Offit, about recently. And we were talking about, is nursing your baby enough to take the place of vaccines? And it's not. Just like we chatted, it does provide some level of protection, but really not enough that we know would be protective. Take, for example, when you're pregnant, we check all these labs on you. We check your measles titers, we check your chickenpox titers, varicella titers is what we call it. We check all these different types of levels, rubella, etc. And that's really great because we know how immune you are in pregnancy. But that doesn't mean that your baby is automatically going to have the same level of immunity. The only reason you have it is because you got those childhood vaccines. And that's something
Ooh, that's
really
a good point.
important. That's something really important I want families to understand, because, for example, if you choose not to vaccinate your children, one day your children will go on to become mothers, and their doctors are going to check their titers. And the breastfeeding that you did when they were young is not going to provide that level of immunity. It's actually a vaccine that provides that level of immunity. And so and that really goes across the board, whether it comes to be COVID-19 or any really vaccine that we have out on the market. It's amazing kind of the way it works is that the antibodies that you gain in pregnancy or that you kind of gain in the newborn period during mom's pregnancy, they last about 6 months. I kind of call it their shelf life lasts about 6 months. And amazingly, around 6 months, your baby's kind of had about 2 to 4 doses of their childhood vaccines. So it's kind of great that we have this bridging system. And that's why you often
while they're getting vaccinated, it's like it's providing that extra layer of protection.
And that's why you often see that the AAP or the CDC or the WHO recommends, breastfeeding for at least X amount of time. And usually it's 6 months so that we can kind of get that bridging period. I want moms to know though, that even if you choose not to breastfeed, again, during pregnancy, your antibodies, some of them are being conferred to baby. Even again, your flu shot that you got in pregnancy, some of that antibody protection is going to be conferred to the baby within the first 6 months, even if you're not breastfeeding. And I want to make that really clear. As a lactation specialist, I feel like a lot of women might feel like it's only breastfeeding all the time, but you got to be real. Like some parents choose not to breastfeed or may not be able to if they've, potentially had a mastectomy or other, they might be on medications, for example, that wouldn't be safe. I want to make that clear to them that you're still doing the best thing that you can for your baby.
Yeah. Well, and you do the best you can with the knowledge and information you have at the time,
Absolutely.
Which is why people are here and why I love being able to have these kind of conversations and be able to provide such important education, because then you can make those educated decisions versus ones out of fear or potentially misinformation, which I think is what we're all just trying to do in this world.
Right. Absolutely. The guidance changes a lot. That's why I think it's really important to find a doctor who jives with you, who's up to date.
Yep.
Whether it be ACOG, the American College of Obstetrics and Gynecology, the Maternal Fetal Medicine Society for, high risk pregnancies, whether it be the AAP, all of these sort of academies have really tried to be very vocal during this time about giving the best evidence-based guidelines. Even, American Society of Reproductive Medicine, when it comes to women who are egg freezing and doing IVF, et cetera, where does this fall for them when it comes to getting the COVID vaccine or the booster? So I think it's really important to find a doctor who not only jives with you, but provides you that, evidence-based knowledge and empowers you with your own knowledge to be able to make those decisions for your health.
Well, and then you see it as a team. Right. And I think a lot of times with medical providers, it's like, oh, they're the doctor, there's this separation, whereas, which is also why I love having these conversations, because it's helpful for the world to understand that we're also humans as medical providers. And that the goal is that we work as a team to help you make good decisions that help encourage health. And kind of push you forward. And also it is important. You've heard me say this before on my channel a million times, is that the provider does matter. And so I think you affirming that from a pediatrician perspective also reminds people that not only does their OBGYN matter or their general practitioner, but also their pediatrician as they go forward in choosing a pediatrician for helping guide their care, the care of their child into their lifetime.
Yeah. I think that is so important to mention. And honestly, I'll be really honest. I talk real talk with my families, that I tell them exactly what I would do. This is what I always tell my parents in my practice, is that I treat your kid like they were my child.
Good.
And so for example, if the 7-year-old is, mom of a 7-year-old is asking me if she should get her child vaccinated, hey, this is what I would do if my daughter was 7 years old sitting right here in this table in front of me. And I think that's really important to kind of put yourselves in their shoes right now. And see all this information. I think it's very easy when we work in the medical community to say like, yeah, get vaccinated. Oh yeah, duh, like of course. But just kind of put yourselves in their shoes and realize like the internet is like this vast amount of information. You look up like, will coffee cause cancer? And you'll find it. And you'll say, will coffee cure cancer? And you'll find it. You'll find it. Well,
I wish it did.
I wish, right? Maybe that'll be our next study.
Right?
I volunteer.
I definitely volunteer.
But I think that's really important to put yourselves in your patient's shoes and just realize they're trying to do the best thing they can. When you're a pregnant woman, you start thinking about that life from then on. And I shared a really real moment with my followers. I shared on YouTube about when I was pregnant and found out I had COVID-19. And it was November. So the women who potentially got it in March 2020 in the very beginning hadn't yet delivered their babies. And there was, a little bit of uncertainty, a bit of uncertainty.
Yeah.
And I kind of had just sat on my steps and like cried because I was like, okay, I've been doing this for now 8 months, taking care of everybody else. And we wanted to get pregnant, we get pregnant. And then this is kind of the card that life dealt me, was like, you're going to get COVID-19 and you don't have a vaccine yet. And good luck with that. We kind of don't know what's going to happen. And I think I just had this like moment of like, I didn't know what was going to happen. And it was kind of like, I was tired of kind of holding it all together. And it was, I'm a really big believer in sort of like our emotions and how we parent. I try to parent positively. My daughter sees when I snap and I hate the way I feel if that happens. And so I really try to be the best example of what I would want her to be. And she kind of saw me at my lowest point there. And she kind of saw mommy cry, and she was like really upset and wasn't sure kind of what to think of it. And I was thinking like, I should be wiping my tears. I should be like putting a smile on my face, but I didn't have it in me at that time. And so I always share kind of that story with moms sometimes when they ask me, and I'm like, this is a really real time. It's a lot. And it kind of stripped a lot of us really bare, really makes you realize how much, if you want to call it resilience or grit is what they call it, but how much BS can you really deal with? And so it's been a very tough time. And I think that just like you said, your provider matters. Like, we're here to help you and we want to provide you with knowledge. And I hope when you guys see this, even if it's 6 months from now, you walk away with feeling that.
Yeah. Yeah. Well, and also acknowledging the emotion in it, that these are hard decisions, that they're overwhelming, that being pregnant is hard enough. And in the transition to parenthood, that's enough going on in your brain. And then you layer the pandemic on it and making these big decisions and all the what ifs and the unknowns. Even now we know a lot, but like, there's going to be new data in the future. And some of this will change. And that's just modern day science of us evolving with the more information we have, but we have to do the best we can with what we know now. And so that's overwhelming. That's a lot. And that already you're managing a lot. And then you layer all of this, all of the big decisions on top of the pandemic on top. And so it's okay that it's hard. It's okay to have those breakdowns. I think about you and like your daughter seeing you that way. And I'm like, I feel like that's real life, and sort of this, like, we need to acknowledge and not ignore how hard this is, and also develop some this is a whole nother YouTube video, but like some really positive coping for how do you manage and how do you balance living your life and, while also protecting you and your family, and making those decisions. Like for me, in the middle of the pandemic, when we knew hardly anything, my sister was giving birth in Minnesota. And I remember traveling and being like, had this whole protocol. I was like, maybe I drive from California to Minnesota by myself, but then I'm stopping at gas stations and do I pee in public? Like, there was just like all these layers too, where we've all had to manage for the last 3 years. And you brought up grit and resilience. And I think if anything, we can acknowledge that all of us that are still here can do a lot harder things than maybe we thought we could going into this.
Absolutely.
Which also means we can continue to do hard things and make these decisions and navigate the scenarios that we weren't expecting. Again, analogy for labor. Labor is never that way. I always say flex and flow. Like, this is life, right? This is navigating life and the changes and how it evolves and what we're up against. And sort of as we go from there, what we're doing is small doses of hard equal building resilience, right? And being able to manage harder or other hard things in the future. So that's the fruit that I see from all of this. Maybe that's like uber positive. But I think it's also important to acknowledge, that like we can do hard things and we've done hard things. And these are hard decisions. You may not feel 100% confident, but it's that weighing scale of which outcome is more important to me, and from a medical perspective, when you're taking in the professional advice around you, it is Swiss cheese model. I'm going to use that going forward. But of masking, hand washing, social distancing, and vaccinating, no matter where you're at in your pregnancy, in your postpartum course, in your breastfeeding journey. And then we will be back to talk about kids, which I'm so excited about continuing this conversation. Can I intro that piece? Can we go there? I'm so excited.
Yeah, absolutely.
Transition. So we are actually going to come back because I hope you found this conversation super valuable with a lot of nuggets to kind of take a moment, let it settle, let it marinate, and then stay tuned because we are coming back for another conversation related to COVID-19 pandemic stuff, vaccination, and children. So we are going to get to pick your brain specific on the pediatric side. For those of you that do have kids, that have babies to teenagers, what are the recommendations? What do we know? And then how do you navigate those decisions going forward? So before I close it out, do you want to let them know where they can find you? I will link everything in the description box down below per usual.
Sure.
But you have a lot of resources out there that I think are very valuable to this audience.
Yeah. I've been trying to talk about this topic pretty openly for almost now, I guess, 3 years. So there's a lot of data out there that you can find on my platforms. So on Instagram, I'm at Dr. Amna Husain. On TikTok, it's the same thing, at Dr. Amna Husain. And actually, on YouTube, it's Dr. Amna Husain. It's pretty simple. But I was going to say, you can just always search. And when it comes to YouTube, for example, I have it separated by pregnancy because like I've said, pediatrics and OB, we have different fields. I could never manage a pregnant woman, but again, we think very similarly, and we often kind of publish and read the same data. And so
You're very flowy team.
Very much so. And so I have a whole playlist where we talk about, my own COVID experience in pregnancy, the things that I kind of did and was on the lookout for during that time, but even breastfeeding as well. There's a whole playlist on there. And we've talked about the COVID vaccine and breastfeeding and what we know. And, actually this is way more up to date than even some of that data. So, but if you guys have any, very detailed questions about it, feel free to always shoot me a message on any of those platforms.
I love it. I love how accessible you are. And where are you located for those people that are
so they're unlike you on the West Coast. I'm on the East Coast. So I am in New Jersey. I'm in New Jersey, and it's great because I do get a lot of questions and families and media outlets, etc., that are right here in New York, and I'm able to answer questions for them. And so you might sometimes see me on news outlets as well talking about that. I also am a part of the AAP, and I'm a media spokesperson. So we do try to get out as much evidence-based, up-to-date data and guidelines that we can at this time to not only help our parents, but also help obviously their children during this very difficult time.
I love it. Well, we are so grateful to have you as a resource here. And with that, thanks everyone for being here and engaging with this conversation, sticking around. Hope you found it super duper helpful. And then make sure you subscribe down below, subscribe on both of ours, in order to continue this conversation when we come back for part 2 on vaccines and COVID-19 for kids. And until next time, the spiel, my spiel is don't forget to flex and flow, and we will see you soon.